Okay, so the password is Mayflowers. I'm going to go ahead and perform my head-to-toe assessment. Okay, knock knock, can I come in?
Yeah.
Perfect. So hi, my name is Sergeant Rincon. I'm going to be a student nurse and I'm going to perform a head-to-toe on you. Is that okay?
Sure.
Perfect. So I'm going to go ahead and identify wash my hands per CDC guidelines, put on my gloves. I'll identify my patient. What's your name and date of birth? Okay, perfect. Do you have any allergies? So I'm going to go ahead and close the current, provide my patient with privacy, make sure that the bed mechanics are up to par. And then, do you have any pain today?
No.
Perfect. So, do you know what the name of the president is?
Joe Biden.
Do you know what day it is today?
Wednesday.
Okay. Why are you here?
Because I'm going to make an annual check.
An annual check. Okay, so my patient is oriented to times 4. And he has no pain. So, do you have any allergies? Okay, perfect. So I'm going to go ahead and start with his head. I'm going to check for any bumps, any lumps. No, okay. His hair is dispersed evenly, secreting oil like it should be. Does anything hurt?
No.
Okay. There's no lumps, no bumps, nothing. I'm going to go ahead and check the ears. No drainage. Does that hurt?
No.
Does this hurt?
No.
Okay, no drainage on this one either. So the cartilage is everything looks fine. Nothing hurts. So I'm gonna check for his face. Everything is symmetrical. Do you have any pain here? Here, have you had any trauma on your face?
No.
Okay. So I'm gonna check for purg on his eyes. Look at me. Okay, perfect. Perfect. Can you follow my pen? Okay. And now can you open your mouth for me? Check the oral mucosa. Is it lubricated? Can you stick on your tongue? Side to side. Okay. He has a strawberry tongue. His tongue is pink, hydrated. His lips are hydrated. There's no cracking. My patient is also dressed up to par for the scenario, which is the hospital. His hygiene is perfectly fine. He has no slurred speech. His nostril, he has no septum deviation. Can you put your head back in? Okay, it's all patent as well. Perfect. So now we're gonna go ahead and proceed to his neck. He has. Does any of this hurt?
No.
Okay. There's no scarring, no bruising, no lacerations, nothing that's concerning on the skin. I'm gonna check his thyroid. I'm gonna put my hand on the cartilage, have him swallow, and then I will move my fingers forward, and that's when I'm gonna check. And feel perfectly fine for the cartilage. Okay, I'm gonna check for JVD. Okay, midline is trachea. There's no distended veins. So then I'm going to go ahead and, can you feel this? Okay, so you can have sensitivity of the face. Okay, perfect. So then I'm going to go ahead and look at his skin overall. He's not cyanotic. Okay. So I would check like literally his whole skin, but obviously we're on camera, so I'm not gonna do that. But yeah, he's not cyanotic. His lips are not purple either. He doesn't appear to have any jaundice or any sore. His skin is moisturized. I'm gonna check his turgor. Okay, good. Everything moisturized. He seems hydrated because of his turgor. Okay, so I'm going to go ahead and check for his upper extremities. Can you sit forward, please? Go like this with your arms. Okay, so range of motion is good. Can you shrug your shoulders? Okay, so he has resistance. I'm going to check for his pulses. Okay, also his carotid, which I skipped over, one at each time. Then for his radial. Okay, and I will check this brachial and radial in both arms, in both upper extremities. Okay, so can you go like this for me? No, like this. One last one, like this. Okay, so no clubbing. Do your joints hurt? Okay, any of that hurt? Okay, can you, okay, cool, perfect. So he has resistance, so that's good. I'm gonna check his capillary reflux now that I'm here. Okay, it's less than 2 seconds actually, so that's pretty good. He's warm to touch, like normal. It should be, there's, you know, the temperature is not cold in here. Okay, so, oh, the owner pulse as well. Okay, the owner pulse. Okay, so then I'm going to check his lung sounds. So it's here. Okay, breathe in, breathe out. Perfect. And I would essentially like to spend a lot more time on each quadrant, but for time purposes, continue to breathe in, breathe out. And I would do it under your shirt, but I'm not, you know, I'm gonna take off your shirt now. Okay, and then okay, and since I'm at it, I'm gonna hear his lung sounds as well. So his aortic, pulmonic, herbs, tricuspid, and his mitral. Okay, so they're all good. His lung sounds are bilateral, or his heart sounds. There's no bruits. I'm gonna check actually for bruits now. Are there any bruits? No. Okay. No accessory muscle use either. Okay. So then I'm gonna go ahead and check for his skin integrity on his chest. I'm gonna act like I did. Okay, cool. There's no lacerations, no scarring, no tissue damage. Do you smoke?
No.
Have you had any previous history of respiratory infections? No. Okay. Can you breathe fine? You've never had an issue with breathing or anything? Okay, perfect. So then I'm going to go ahead and check now for his back. I'm going to go ahead and go down on his spine, for his position on his spine. Does anything hurt as I'm going down? Anything, any pain? No? Have you had any trauma to your back? Okay, perfect. So then I'm going to go ahead and I already got his lung sound, back. Okay, so I would also, while I'm on his back, I would check also the skin integrity on the back, make sure that he has no pressure, also maybe like on the coccyx area or so forth. Okay, so now I'm going to go ahead and check his abdomen. I was just checking the time. Okay, so then I'm going to go ahead and put up the shirt. So start with his right lower quadrant. Right lower quadrant. It's that first, perfect. Everything looks fine. I'll go ahead and auscultate. Okay, from right lower to right upper, left lower, and I would spend a minute in each quadrant. If there is any irregularity, then I would spend a little longer. If you have pain in any of those quadrants, I would leave that quadrant for last. All bowel sounds are present, they're normal. Now I'm going to go ahead and percuss. Let me know if anything hurts, okay? Any pain, any discomfort? Okay, perfect. Okay. No pain, no nothing?
No.
Perfect. So nothing, I don't see any bulging, any masses, I don't feel anything either. Anything that's fine, he has perfect skin integrity as well. Do you have any nausea?
No.
Vomiting? Have you ever had an obstruction? Any GI problems?
No.
Okay. What was the last time you had a bowel movement? ¿Última vez que fuiste al baño hace número 2?
Like 4 hours ago.
Okay, perfect. And do you have any pain when you use the bathroom? Like
No.
your urine that's fine, no blood, nothing concerning? Okay, perfect. So then I'm going to go ahead and check his lower extremities, and I am at 11 minutes. Okay, his lower extremities. You can put your hand on me. Does this hurt? That hurt? Okay, so I'm going to see if he has any edema. He doesn't. I'm going to check for his tib pulse. Essentially, he wouldn't have his pants like this. But okay, tib pulse. And a pedal as well. And I would do the same pulses for this one. So here. Okay, so they're bilateral, they both are fine. I'm gonna look at the integrity of his nails, cap refill, less than 2 actually as well. Can you push back on me? Perfect, so he has resistance, skin. I would take off the sock obviously, but so his skin is intact, perfect. Same thing, nail, perfect, resistant. Okay. So perfect. Do you use any walkers, any crutches, anything perfect? So he has nothing in the skin, no redness, no swelling, no pain, he said. Perfect. So can you stand up for me, please? Okay, close your eyes, put your hands out. Okay, and I'm checking for his gait and his balance. Okay, perfect, he's not balanced, he's not moving around. Can you walk for me, please, with your eyes closed? Okay, that's fine. Perfect. So, ya puedo regresar. So perfect. Ya te puedes sentar. So his gait, his balance is perfectly fine as well. I'm gonna check for his lymph nodes that I had forgotten earlier. So there's some here. And I can check for on the subclavicle or supraclavicle, subclavicle. This was the axillary one. I want to check it on both sides. And he's ticklish. Okay. Perfect. His femoral as well would be here, next to his groin area. I would check that pulse as well. And okay, and then okay, so I think I checked everything. Okay, perfect. So, do you have any concerns about anything? No? Okay, perfect. Do you feel safe at home?
Yes.
Okay. Have you ever thought of having thoughts of suicide or hurting others or yourself?
No.
Okay. So, have you had any falls before? Have you ever fallen?
No.
Okay, perfect. So my patient is non-fall risk, which is awesome. He feels safe at home. No suicidal ideation. And not to him, not to others. And so we're good. Thank you. Have a good day. The doctor will be with you shortly. Okay?
Thank you
I'm
so
gonna go ahead.
much.
Thank you. I'm gonna go ahead and wash my hands per CDC guidelines and make sure to adjust the bed mechanics one more. I'm gonna put the call light next to him. If you need me, you can press that button. And yeah, I'm gonna open the gate, the curtain, make sure everything's put back to how it was before. And I'm done. Thank you.